deeper and deeper. Now at this point, I'm going to incorporate something that very few people ever really use, but it is an extremely effective way of finding the answers that may not be known to the conscious mind. These are called finger signals. Now, you can have a person nod their head or shake their head, but a lot of times when they move their head ever so slightly, which is a very common experience, sometimes they do this consciously. What I'm going to show now is a very subconscious movement. Deborah, what I'm going to do is I'm going to ask you some questions. Now, you may or may not know what the answers to these are on a conscious level, but I'm going to demonstrate to you how this really works. I'm going to help you to relax even more deeply, because as I touch your right arm and hand now, you're going to allow it to drop all the way down, and you're going to feel a wave of relaxation settle over you. All the way down deep inside. You're going to find that when I ask you questions, these are what we call finger signals. Everybody does them. We all motion to people. We curl our finger to say, come here, or we'll point our finger and say that direction. Or we might shrug our shoulders. We do a lot of unconscious things. What I'm going to do now is I'm going to show you what a yes and a no finger is. And the way to do that is to touch your index finger on your right hand and your left hand. I'm going to straighten out the finger on your right hand now. Now, what I'm going to do is I'm going to ask you yes and no questions. This is going to be your yes finger, and I'd like you to keep it off of your dress. And this finger on your left hand is going to be your no finger, and it's going to be kept up just ever so slightly. The reason for this is because when there is no point of reference, such as another finger that they can feel, or their pants or their dress, and they feel it leave, it becomes a conscious movement because they're aware of it leaving something. But when it's up in the middle of nowhere, it can rise or fall without them even knowing it, just like the arm would go down slowly or come up slowly. The finger that I'm touching now is your yes finger, and the finger I'm touching now is your no finger. In other words, let's say, for instance, I were to ask you, and you can do this consciously just for a second or two, just to see how it works. If I ask you if your name is Deborah, obviously your right index finger would move. If I say to you, are you 20 years old, your no finger would move. If you look very closely, you will be able to observe an ever so slight movement. If I say to you, do you live in California? The answer is no. And it has moved ever so slightly. If I say to you, do you live in Spokane? The right index finger moves. At this point, you could ask her or your client any question that they may not know consciously. Let's say, for instance, you wanted to find or help your client find some jewelry that they misplaced. If you were to ask them if it was in the bedroom, perhaps their no finger would move. And if you ask them if it was in the living room, their no finger may move. But if you were to ask them, is it in the bathroom or the kitchen? All of a sudden, you will find that their yes finger moves. And if that's the case, then all you have to do is zero in on it and say, all right, is it in a drawer in the kitchen? No. Is it under the stove? No. Is it in the refrigerator? In the ice box? All of a sudden, yes. Now you help them find their jewelry. The same thing is true of almost anything else. Suppose she had an illness and she wasn't exactly sure what that illness was, and a doctor wasn't able to find it. You could start asking her questions of her subconscious mind, because the subconscious knows everything that's wrong with you, physically and mentally. If I were to ask her a question, is it in your abdomen? Her no finger would move. If I ask her a question, is it in your chest? Her no finger would move. If I say to her, is it in your lower back? And her right index finger moved, her yes finger. We know the location. Sometimes this is how you find medical problems for people when doctors do not know the answers. And some of those medical problems may seem like they're physically related, but the subconscious never lies. And so the subconscious will tell you, no, it's not a physical problem, it's an emotional problem with a physical outlet. That's how it's solved. Then all you have to do is ask the subconscious mind, well, is there anything you want to talk to me about this? Why are you allowing it to show up on a physical or kinesthetic level? And that's how you use finger signals. Now, Deborah, I'd like you to slowly bring yourself back up to the point of where eventually your eyes will open. Each and every time you do this, you're going to go down deeper and deeper and faster, and you're going to be able to remember what I just taught you on a subconscious level. So in the future, if we ever again use finger signals, you'll know exactly how they are to be used. And you will not need me to teach you again. Notice how good you feel. And your fingers are still up. You can let them down. How do you feel?
Good.
Good?
Mm-hmm.
Do you have any thoughts about anything that we just went through?
About asking questions and giving signals.
Did that make sense to you?
Mm-hmm.
Was it easy?
Yes.
Okay. Deborah, what I'd like to introduce you to is what I call a confusion technique, or a misdirection. It's very easy to do. So in order to allow it to happen, all I ask of you is to kind of keep up with me as best you can with each of the suggestions I offer to you. Each of the things I ask you to do, try to do what you can. And go